Welcome, everybody. Welcome. I'm going to say, Jamie Alexanderson, if you can hear me, will you wave hello? There's my colleague and friend Jamie waving in the back, giving me a sign that she can hear me back there. And what about some of our guests who are sitting in this back table? Can you wave if you can hear me okay? Is the volume good? Excellent. Now, there's still a few stragglers who are late for school today, but I think we're going to have to get started with our Lunch and Learn because we're so thankful to have Dr. Choudhry with us, who has to go back to the clinic. So we have to get started here. So could everybody in the back come and find your lunch, find a seat. It's going to be a full house today, but there should be seats for everybody. This is such a hot event. We had 5 new registrants last night. So people are just going to be streaming in. Is there a little bit of background shushing noises, or is this good sound? Okay. I'm getting the thumbs up. Okay. Is everybody ready to start? Everybody ready to learn? And lunch? Lunch and learn? Excellent. Okay, well, welcome. Thank you, everybody, for being here. My name is Dr. Mary Sunderland, and I'm the Director of Research and Education at the Foundation Fighting Blindness. In my role at the Foundation, I oversee the Foundation's research program, where every year we fund scientists who are working to develop new treatments for blinding eye diseases. And I also oversee education programs like today, which we host across Canada. Thanks to our generous donors, many of you are here in the room today, the Foundation Fighting Blindness is Canada's largest charitable funder of vision research in Canada. So far, we've invested more than $32 million to find a cure for blinding eye diseases like age-related macular degeneration. And we're a small but mighty team, so I'd like my colleagues to kind of stand up and wave so people can see it's not every day that we get to hold an event that's really in our neck of the woods. Our office is just across the street, so we're all out here today and we're so happy to be meeting you. Now, I'm a scientist, but really I'm a student and a teacher at heart. So I love Vision Quest education sessions. I love the feeling of being back in the classroom, and really there's so much happening in vision research right now. There's so much to learn. I think we could have a Vision Quest event every week, and there'd be new content. So who'd be ready to come back next week? I'll ask you again at the end. And so who is at their very first Vision Quest event? Can you put your hand up just so we can see who's new with us today? Wonderful. So let me tell you a little bit about what you're going to learn today and what it's all about. So Vision Quest is the Foundation Fighting Blindness's educational program that brings together the people who are playing a key role in fighting blindness, including scientists who are working in their laboratories, the clinicians like Dr. Choudhry, who are testing new treatments in clinical trials, and our industry partners who are making emerging treatments a reality. I am so thankful. Well, we're all so thankful to the Vision Quest sponsors this year: Bayer Healthcare, Novartis, Allergan, Shire, Spark Therapeutics, and AGTC, who really are key partners in our fight against blindness. Bringing new treatments to Canada, it's just something we can't do alone. So thank you to all of our partners. I'd also like to thank AMI, our partner in accessibility, who brings this critical information out to people who are ready to learn. And we simply couldn't do Vision Quest without all of your support, so thank you. And do you know who else is really playing a key role in the fight against blindness? It's all of you. It's all of you. It's the people who are living with blinding eye diseases and their families. You really do have a critical role to play in making new treatments a reality. And that's why we're so happy to welcome our partners in the back from CCB, from CNIB, who we work together to advocate for the best vision care for Canadians. And really, just by being here, all of you are making a difference. And that's because being here helps us to raise awareness about the impact of blinding eye diseases on patients and their families in Canada. So now I'd like to introduce somebody who really has devoted his career to fighting blindness, and that's today's keynote speaker, who many of you know, Dr. Choudhry. Dr. Choudhry is an internationally recognized vitreoretinal surgeon with affiliations at both University of Toronto and Harvard Medical School. He's a world leader in retinal imaging and the diagnosis and treatment of diseases like age-related macular degeneration, in addition to some of the more rare retinal diseases like retinitis pigmentosa and other retinal dystrophies, which are other diseases that the Foundation Fighting Blindness is working hard to support. So Dr. Choudhry is also actively involved in medical education and has spoken at more than 75 international conferences, so we're really lucky to have him here with us today. He's also widely published and is actively doing research on retinal eye diseases like AMD and retinitis pigmentosa. His new clinic is called the Vitreous Retina Macula Specialists of Toronto. I was blown away when I had the chance to see it this summer, and so excited because it's with facilities like this new clinic that Dr. Choudhry has built. These new facilities are going to play such an important role in taking our fight against blindness to the next stage, to the next level, where we can finally test some of these critical, exciting discoveries on the patients who have been waiting so patiently for new treatments. So thank you again, Dr. Choudhry. Now, again, his expertise is in high demand and he's got to go back to the clinic, so I think I should stop speaking and I should introduce Dr. Choudhry. But before I do, I want to make sure you all know that you have these little kind of newsletters on your table, and inside, I'm saying this because I know he's going to say something really important, and you're going to want to write it down. So inside, you're going to find a sheet that has sort of the details about Dr. Choudhry, and on the back, there's some lined paper that says, I think, your vision science notes. So you won't be tested, but hopefully you can now have a little keepsake that you can take home with you today with all of the new insights about how you can take better care of your vision. So I'll now pass the stage to Dr. Choudhry.
Okay, thank you, Mary, for that wonderful introduction, and I want to thank the Foundation Fighting Blindness for inviting me to speak here today. It wasn't that long ago that I graduated from Harvard in 2011, and I stood in the back watching Dr. Michael Brent up here, who's a wonderful retina specialist in the city, and he gave a similar lecture, and I thought to myself, what a great opportunity to speak and connect with community as well as our patients. And I see many of my patients in the audience today, and I really appreciate you guys making some time. So I really appreciate, again, Foundation Fighting Blindness doing an excellent job in putting together an event like this. And then outside of our waiting rooms, this venue allows all of us to sort of engage and discuss about visually debilitating conditions. So I was asked today to talk about age-related macular degeneration. Some of you in the room may have this condition or know someone that has this condition. How many of you know someone that has this condition? Raise your hand. Great. So that's many of you. And there are many of you that have other conditions or know someone with other visually debilitating conditions. And we'll definitely take some Q&A at the end about all sorts of visually threatening conditions. So I'm going to give a little overview about this disease from my perspective, and hopefully it lands in good ears on you, and really understand sort of the pathway of this condition, what it is, who gets it, where are we going, and what's coming up. So Albert Einstein had a wonderful quote, and I think this should set us off nicely. The most beautiful thing we can experience is the mysterious. It is the source of all art and science. And this applies in so many aspects in medicine, and many times we set on a journey to understand a disease like macular degeneration, and it's a mystery. So 25 years ago, we did not have the same level of information that we have today about this condition. We would attempt laser, and many of you may have had laser therapy for wet macular degeneration, and our hands were really tied, and we were on a journey of discovery. And one of the beauties about being a physician is being able to ask a question, and often that question is, why? And these questions often begat experiments and scientific research, such as that is supported by the Foundation Fighting Blindness, for us to explore our observations and hopefully come up with some answers. So a little bit about me, as Mary did allude to, I'm a retinal specialist in the city in Etobicoke, and I practice both surgical as well as medical retinal practice with various diseases, and I operate in the operating room. But my passion really is in clinical research, and as Mary mentioned, I am on the team of discovery amongst all of our retina specialists in Toronto and in Canada, trying to push the needle, move the field forward, and find cures and solutions for all these problems that many of you are experiencing. So what is age-related macular degeneration, or AMD, or ARMD? And this is one of the leading 4 causes of blindness in Canada, and one of the leading 4 causes of blindness in the world, outside of cataract and glaucoma, as well as diabetic retinopathy. And this condition is a very interesting one in that it tends to affect people over the age of 50 to 65 years of age. And it's not as straightforward as, for example, diabetes, where we think about having a high blood sugar, which subsequently can affect blood vessels. Macular degeneration is what we call in medicine multifactorial, meaning many different factors cause this condition. And so what we've learned over the years is that there is a significant amount of our inheritance, or our DNA, or our genetics that's responsible for having this disease. And some of the risk factors or risk factors that we see that can cause this condition are being female more than male, having light-colored eyes, light-colored hair, having light-colored skin, so it tends to affect more Caucasians than non-Caucasians, having a family history. So as I said earlier, DNA, genetics, we can't pick our parents, and so in some ways we also can't control whether we are going to get a condition or not. Smoking is a significant risk factor. So those of you that are in the audience that are still trying to quit smoking, it's one good reason to make that move today. High blood pressure and diabetes continue to be a sort of a question mark as to how tightly they are associated to this condition. And so those are the big features of who is at risk for getting these conditions. And so the condition itself comes in 2 different forms, and we're going to touch upon those 2 different forms. And as I mentioned, the risks, as we just outlined, include a lot of factors that we don't really have that much control over. The one we do, of course, is smoking. So preventing macular degeneration is an interesting question. I thought I'd put together a series of slides that would answer a lot of the questions that I see my patients asking in the clinic or speaking about in the waiting room. And having it in this sort of relaxed environment gives us an opportunity to think more about some of the questions as well as these answers. Obviously, as I said, we cannot change our inheritance, so there's a difficulty with prevention there. But lifestyle is a significant aspect of prevention. So how many of you have heard that macular degeneration can be helped by eating a heart-healthy diet? Many of you, right? There's no one around that's going to say, don't eat a heart-healthy diet, it's not good for you. So it's pretty much always good for you. And, things to avoid include excessive amounts of anything, excessive amounts of red meat, excessive amounts of, sugary substances. All of these things in excess are bad in general. But as far as macular degeneration is concerned, the eye is an extension of the brain. So when we speak about macular degeneration, we're talking specifically about the retina. And the retina is born out of the brain development. So anything that would be bad for your brain or for blood vessels is also bad for the eye. So that's why we tend to, as physicians, push the idea of eating green leafy vegetables and limiting your red meat intake, obviously not smoking, having a good balanced diet, limiting your sugar intake. While not directly connected to macular degeneration, it is connected to your overall health. And I don't think any of you in the room would argue with the same adage that my parents and grandparents told me, which is, you are what you eat, right? So we know if we eat well and we live a healthy lifestyle and we exercise and we don't smoke, chances are we've limited all the reasons to get conditions outside of your genetics, which of course none of us can really control at this stage. So how do I know if I have AMD? And we get this a lot because there are your family members or my family members and patients' family members coming into the room with their loved one for their treatment or for their exam, asking, my son, is my son, and how is he likely to get macular degeneration? How does he know? So one main way to identify if you are developing this condition is by having an eye exam. So how many of you get an eye exam once a year, at least, with your optometrist or ophthalmologist or retina specialist? That's pretty much everybody. And so having a complete eye exam, which obviously involves a retina exam, is pretty definitive in determining whether you are developing or at risk for macular degeneration. You know, we live in an era which, again, Mary and the FFB have done a beautiful job recently that I've seen of even disseminating information into our email accounts, online, in every media form possible. There's no shortage of nowadays reasons or ways of getting information. And our technology and our ability to detect small changes in an eyeball and in an area of the eye, like the retina, has advanced so greatly. And in many cases, what we're talking about is looking at tissue, the retinal tissue, on the order of micrometers. So if you look at your fingernail, a small fraction of your fingernail is what your eye doctor is looking at with their lenses when they look inside your eye, and hoping to detect the earliest change that could be indicative or indicate that you are or are not developing macular degeneration. So some of the signs and symptoms of this condition include sudden loss of vision. So sudden loss of vision is a big umbrella or a big, wastebasket, as we call it, in that many conditions can cause sudden loss of vision. But macular degeneration is also one of those conditions which can cause sudden loss of vision, and that often would happen from bleeding. Other signs and symptoms of macular degeneration can include wavy or distorted vision. So how many of you have heard of or seen an Amsler grid? Almost the whole room. And so an Amsler grid is basically a nice checkerboard pattern that was created many years ago as a screening tool for us to look at with each eye to determine and see whether there was anything abnormal. And the human brain is a wonderful thing and is able to detect small little changes within that grid, and whether it's wavy or missing pieces or it looks like Swiss cheese to you, any of those types of changes can be indicative of possibly having macular degeneration. So there are two kinds of macular degeneration. And how many of you have heard of dry macular degeneration? Great. So let's talk about dry macular degeneration. So this is a very interesting disease in that we are putting towards this condition many millions of dollars to find a cure, because at the moment, there isn't a single magic bullet cure for this condition. So dry macular degeneration, much as this image shows, for those of you that are able to see it on the screen, it's been a journey to discover what is actually happening with this condition. And so when we talk about dry macular degeneration, the term dry means no bleeding, whereas wet means bleeding. And we'll talk about how that happens for wet macular degeneration. But with dry macular degeneration, you can think of it as though walking on a cobblestone road. Montreal and Quebec is known for the beautiful European experience, and I often in my mind use that analogy to describe dry macular degeneration. We, in this condition, see protein deposits develop like cobblestones in the retina, and those cobblestones make up what we call dry macular degeneration. In fact, the term drusen is used to describe these yellow deposits, these protein deposits. Drusen is actually the German word for stone, so it all fits together, back to the cobblestone road. And dry macular degeneration is a very slow version of macular degeneration. It can progress very slowly over years, and in addition to the cobblestone protein deposits that develop, the tissue actually starts to disappear. So if you think of a pothole in the road, or you think of Swiss cheese with the different areas that are missing of cheese, that starts to happen within the retina. And it's when that happens that vision loss actually occurs. So signs and symptoms, again, of dry macular degeneration can include wavy vision, again, the cobblestone sort of appearance, and then also loss of vision and patches, okay? And so one might look at someone's face and see part of the face, and then part of the face is missing because that tissue is missing. So dry macular degeneration is a very difficult disease to treat because we're missing tissue in this condition. So it's similar to if someone had a piece of their arm bitten off by a dog. You don't grow that piece back right away, do you? You try to sew it back together, but effectively there's a piece of the organ missing. So a lot of energy is now being directed towards helping to regenerate some of this tissue. And so in a few minutes I'll describe some of the newer therapies that are being looked at, which are on the horizon. Wet macular degeneration. How many of you have heard of wet macular degeneration? Again, many of you, this is again a very repetitive, you probably know a lot about this by now. And this condition, and we have a nice image to sort of highlight that, it's a more difficult condition because the vision loss can be sudden. As I mentioned earlier, one of the signs and symptoms of wet macular degeneration can be sudden vision loss. And what happens here is the retina is getting signals to develop abnormal blood vessels. So all of us have seen a garden, and we've seen dandelions grow on a garden. And effectively what's happening is abnormal vessels are growing like dandelions in the retina, growing up from the base of the retina, and then they bleed into the retina. And as I mentioned earlier, the retina is an extension of the brain. So it's brain tissue. So you can imagine if you have bleeding in the brain or brain tissue, it's bad, right? So this bleeding, if it is not treated quickly, then it starts to form a scar. And this scar tissue damages vision cells forever. So when, as physicians, we talk about and teach about and educate about wet macular degeneration, we like to make sure that the Amsler grid is being educated upon and that we inform everybody that as soon as you experience signs or symptoms of wet macular degeneration, again, wavy vision is still on the list, loss of vision still on the list, that you tell your doctor right away, or you tell your family member to drive you into the doctor right away, because the sooner we can treat the dandelions, the abnormal vessels, the better the outcome for your vision. That is, once scar tissue forms, much like anywhere in the body, we never really get rid of scar tissue. You know, all of us have scars somewhere on our skin, and you know, we've nicked ourselves here and there, and sometimes the scars are worse than others, but in the retina, in the eye, they cause absolute irreversible vision loss. So I know what you're thinking, well, why don't we just do a surgery and remove the scar tissue? Great idea. We all thought about that as doctors 20, 25 years ago, and there was a study, a trial, a clinical trial that was done to go into the retina, do a surgery, try to remove the scar tissue, and we were successful in removing the scar tissue, but the vision never came back. So it tells us that once the scar tissue is there, the cells are damaged, and even if you remove the scar tissue, the cells are still damaged. So the goal should be to prevent scar tissue, okay? And so it's in wet macular degeneration that the timing is very, very key. And many of you in the room may know someone or yourself may be receiving treatments for wet macular degeneration. I just finished a morning where I gave a number of patients treatments for this condition. And it is like riding a sailboat. And there are good months and bad, and you go up and down, and we look at the fluid that accumulates from the bleeding, and we treat it according to our own pattern as we see that's appropriate for the patient. But it is a journey. And both of these versions of macular degeneration are a journey in treatment and in a relationship with your physician and your eye care provider, and do really put patients to the test and to how patient you can be as we go through this process of finding an ultimate cure. You know, one of the things we think about when I try to talk to my patients about this condition is it's not like an infection. All of us at some point have had some sort of infection, throat infection, you know, ear infection, whatever it is, and we're told, the doctor says, take this for 7 days, it'll be gone, and sure enough, it's gone, and you're back to your regular life, and your throat is feeling better, your ear's fine. This isn't like that. This is like more of an arthritis or a process that, you know, has good days and bad, and it needs lifelong treatment. And we see that with high blood pressure, and we see that with diabetes, The medicines that we as physicians give to all of our patients for those conditions, they don't cure high blood pressure, they don't cure diabetes, they help to control it. And so similarly with wet macular degeneration, our goal ultimately is still a cure. We're all working on that, and we'll talk about that. But for the moment, our goal is controlling it and making sure we have a smooth journey on the ocean of wet macular degeneration rather than riding the tsunamis. So as we go forward, what about diet and vitamins? And so this comes up a lot, and I think it's a very important area of medicine, but also in eye care. And as I said earlier, diet-wise, I think all of us understand the importance of balance and having a diet that's rich in green leafy vegetables. We get questions often about blueberries and raspberries and all sorts of berries. They taste great. They're good for you. And so why are these part of the regimen that we recommend as part of your diet? Again, there's no amount of blueberry or green leafy vegetable that I can tell you in a serving size. I'm not a nutritionist. But having those integrated into your diet is important. Why? And the reason is everyone in this room has one thing in common. We're all aging, and we're not getting younger, none of us. And the reality is that's a process. Yeah, exactly. It's not a big surprise. But the reality is that's all happening by a similar mechanism, a similar process. And the aging process is in medicine called oxidation, and that's a big fancy word. But it basically means aging, and all of our cells are aging at a different rate. These food items that we talk about, the green leafy vegetables, the berries, the green peppers, yellow peppers, these brightly colored fruits and vegetables, they're good for you and they're good for us because they help to slow down aging. They contain antioxidants. So having a good amount of these in your diet will allow you to live a healthy life and slow down the natural aging process. And all of us, again, can't avoid aging, but we can be responsible with our diet and how we think about it. So I hope that sheds a little light on why those items are cherry-picked to you to educate you about what to eat. Vitamins is an interesting element. How many of you are on some sort of vitamin in general for your overall health? A lot of you. How many of you are on a vitamin for your eye? Same group, okay. So vitamins have been shown to be effective for the eye, specifically for macular degeneration, and a lot of the research is largely focused on macular degeneration because there are so many different factors that cause this condition. And when we talk about vitamins, there's actually newer data that has come out that has shown us that a small fraction of patients, a small group of patients, cannot just take any vitamin that's an eye vitamin over the counter. And the reason for that, which has been put forward in the literature, is that as we all know, we're all different from one another. We all look different, we feel different. Someone might take one medicine and have a better result than another. Similarly, there's a small group of patients whose DNA does not jive or marry well with every kind of vitamin. And so now there's an increase in information coming out about genetic testing in macular degeneration. And so without getting into a huge discussion on genetic testing, it is something that you will or likely will hear a little bit more about as the coming months and years come forward as it pertains to macular degeneration. So in the future, where we are going with, just like your nutritionist or your doctor or your healthcare provider will tell you that for you, Mrs. Jones, you need this diet. Similarly, we are going in this direction with medicine in general, where we all would like to have a personalized treatment plan, meaning some vitamins would be good for person A and others would be good for person B, and making sure it's a very tailored experience for you so you benefit the most from it. Again, getting back to the reason of that is that we're all different. We have different genetics. So while Vitalux may be good for me, Arid's PreserVision may not be good for me. And some of this personalization is where we are going with our vitamins. So this is probably why everyone's probably here today, talk about new developments and what's on the horizon, what's here. And I think I currently am working alongside a number of doctors in the city who do clinical trials and bring innovative research into Toronto and Canada. And so we're going to spend a few minutes talking about new developments. And in macular degeneration, in addition to diabetes and glaucoma, there is millions and millions of dollars being put towards research. So for all of you who have any of these conditions or know someone that's having these conditions, this is not going to be the final treatment that you hear about or receive for the rest of their or your life. So as far as wet macular degeneration is concerned, currently we treat patients and provide them with medicines that are given every month or every other month or every few months to help control their wet macular degeneration. And those medicines work really well, even more so when we start the treatments early. So one thing as doctors and as patients we hear all the time is, doctor, do I have to keep coming every month? Do I have to keep coming? I'm tired of this. When is this going to stop? And it's frustrating for us as physicians and as researchers because we'd like to make it like an antibiotic, one and done. So where we are going now and where we are is that newer medicines have been developed that are lasting longer. So we are currently in an era where some of the best medicines last probably about 2 months, and the next version that's coming up the chain in the marketplace will last around 4 months, and that's around what we feel is a realistic number, plus minus. Again, everybody's individual, so we don't want to make it a rule for everyone. But to take it a step further, very smart people thought of the invention of a gas tank, right? Those of us that drive, we have a car, we go to the gas tank, we do pay an arm and a leg at the gas station, but we put gas in our gas tank and then we drive till the tank is almost empty. So why could we not do something like that for the eye, where we put a device into the eye, like a gas tank, we filled it up to the top, its maximum amount with the right medicine, and then you leave. And you keep going until the gas tank of that medicine is almost dry, and then you come back to the doctor's office. So that is also here, okay? So you will be now hearing soon, within the next 18 months or so, about an implantable device, which is a procedure in the office and or operating room that is still to be determined, a small procedure. I believe it is for the clinic. And that would be topped up with the medicine that patients who get wet macular degeneration injections every month would get that device topped up, and then they would be able to go for an extended period of time, beyond a month, beyond 2 months, beyond 3 months, and that medicine would just slowly release, just like your car is driving on a gas tank. So very simple ideas, difficult to bring into real world, but simple ideas that we already see in our world now that are going to make their way into our eyes. Further, for wet macular degeneration, obviously we want to make drugs that are longer lasting, that require less number of treatments. It'd be great to have one treatment and go the whole year. It's very hard to make a medicine like this, and many of our companies or industry colleagues in the back will tell you. But there's also a movement towards using small devices, not just like the gas tank, but small little factories. Now, all of us have heard or seen a factory where there are many people working and they're making gloves or they're making shoes. And so we now have the ability to put together a small device which can be implanted in the eye, and it contains all the ingredients of the recipe to make these medicines that we would want to treat macular degeneration. So these little mini cells, like the factory workers, are able to get to work, and they continuously produce the medicine in your eye naturally, without being bought from the store, without being bought from the pharmacy. So these little microsystems are being developed and tested to see whether they can achieve what we hope they can achieve, which is a self-sustaining, self-propelled production factory of medicine. Now, how many of you own a cell phone or a mobile phone? Many of you. And so to take it a step further, it would be great if the mini system or the device that we talked about, the gas tank type device, could tell you on your cell phone, hey, it's time to go back to Dr. Brent or Dr. Wong or Dr. Mooney and say, well, my medicine's about to run out. I better go and get my exam and get topped up. So there is now a connection with technology that is going to be introduced, which will allow our smartphones to communicate with our eye to tell us that, hey, it's time for a refill. So it is amazing that, this is where we are. And it may sound a little, cheeky to say it, but this may be one of the best times to have these kinds of conditions because the most technology and dollars are being thrown at it, and the coolest, most interesting ideas are starting to get some attention. So I want to talk a little bit about artificial intelligence. I know the FFB's done a nice job recently of highlighting artificial intelligence in eye disease, and we hear about it in various avenues of our life, and those of you that have not heard about it, this will be interesting regardless. Artificial intelligence is basically taking computer technology to the next level. So what does that mean? So let's talk about the factory again. In a factory, we currently have factory folks that work there, and they put elements together. Artificial intelligence, it has the ability through a software program to tell us and learn how to do something the best way. So I'll give you an example, and then we'll jump into sort of how this fits into eye care. Many architects use a program called AutoCAD, and this program is a program that the architect says, I'd like to make a airplane, and here is my design, and then the software shows what the airplane would look like, and then the architect and the engineers put it together, and they say, okay, did it fly or did it crash? How did it go? So artificial intelligence now has the ability to take an idea from a human being and give us all the possible options of what the different types of airplanes could look like, or the different types of devices could look like, and then, based on its intelligence, tell us, the human being, which one's the best one. So this was done recently for some of you. I know I've talked about this before. For kids like to play with, and some adults play with the flying drone nowadays, a little airplane that hovers around and it can take pictures, and it's pretty cool and fun. And so architects and engineers put this into the computer, and they asked the question: we want a device that can withstand these temperatures and this environment. Which one? What's the configuration? And the machine said there are 148 options, and it said the best option for what you want to achieve is this one. And it was in the shape of a flying squirrel. So nature has already made the best drone, which is the flying squirrel. So to take it from that idea to eye care, one thing in medicine and in eye care, what we all are challenged with is detecting disease early, and also detecting a large number of patients who may not have access to all the great retina specialists that are in the city, for example. There are countries in the world where there's not someone to do that. So artificial intelligence in eye care is now being developed by a few of us, many of us around the world, but looking at being able to put in a person's OCT image, their retinal photograph, and looking at the retinal photograph, the software is able to say there are 10 hemorrhages in the eye, there are 10 over there, and this patient looks like they have diabetes, and then tell us, the doctor, what stage of diabetes they have. So the ideal way, or the goal of all this, is to, even for radiologists or cardiologists, have images like MRIs and EKGs and echocardiograms, and again, as I said, retinal photographs and optic nerve photographs read by the machine, read by the software, and help guide us as to how frequently we should be seeing you and how likely you are to develop bad diabetes or bad macular degeneration or glaucoma or any one of these diseases. So it's pretty amazing as where we are now. And in the near future, and we see this in the next 5 years period of time, we are working on developing machines where you would come to an eye doctor's office, you would get your pictures taken of the retina, they would have information about your age, your gender, your weight, your blood pressure status, and say that this person needs to be seen every 3 months, or they're going to end up with severe diabetic eye disease and they're going to go blind in 18 months, and be very specific about your follow-up. So This is where artificial intelligence is starting to fit into our world of retinal disease, as well as in general for eye care. It's a very fascinating area, and in other parts of our life, it's going to do remarkable things. Stem cells. This is a wonderful question that gets asked a lot. I'm not a stem cell expert, so I'm not going to pretend to be one, but I can tell you where and how this fits into the paradigm of eye care and eye diseases. So stem cells, how many of you have heard the term stem cells before? Many of you, almost all of you. Good, looking forward to hearing about it. So stem cells, we all have stem cells, and stem cells are basically cells which are very immature. They're in our body, and they have the potential to be converted to any kind of cell. So a stem cell can become a hair cell, not in my case. It can become a skin cell. It can become a retina cell. It can become a brain cell, and it just needs the right environment and messaging to become that cell. So let's rewind back to dry macular degeneration. And we said earlier that dry macular degeneration happens and can result in loss of cells. So wouldn't it be great if we could use stem cells to regenerate retinal tissue? So stem cells are still in a very early phase of development because there's a lot of challenges with getting cells to become what we want them to become. And in some cases, we are able to make a stem cell into a retina cell or a retinal pigmented cell or a photoreceptor. All of that now has been done in labs all around the world, not easily, with lots of difficulty. So now that we have this little small shot glass of cells, how do we get it into the eye and get it to stay there and make friends and have a family and spread and fill the gap? So that's the challenge where we are with stem cells now. We have been able to convert stem cells into some of the cell types that we'd like. We've been able to inject raw stem cells and see if their environment makes them into the cell that we want. Getting them to play well with others and become like their neighbors is where we are currently working aggressively to fill in the gap, as it were. So stem cells are still in the early phase. They're not an idea. We've taken the idea, we've taken it off the tree. We've manufactured these stem cells in small labs around the world. We've checkmarked, yep, that's a vision cell, that's a retina cell, that's a skin cell. Now, we can get it into the eye. Surgeons like myself and others have the ability to do that. But getting it to stay there and then work and function. So that's the sort of update on stem cells for now. And we want to make sure that as we go